10 years ago, because now there's a little bit of difference. But 10 years ago, what did our government, the pyramid food charts and all those food charts say? How many fruits and vegetables you're supposed to eat in a day?
3.
3 to 5. Yep, 3 to 5. What do I say? What does the National Cancer National Cancer Society? What's the FDA? Not the FDA. The Food and Drug Administration. FDA. Not the FDA. I'm blanking. What are you supposed to take? Keep going.
15.
10 to 15.
Thank you.
Because the pesticide.
Thank you. 8 to 13, 8 to 15. That's exactly right. A full serving. It's not that tomato slice that was in that Panera sandwich that you had this morning. That's not a full serving. Whole tomato is a full serving. So 8 to 15. That's a little difficult to do. We kind of do that. We kind of get there, but we struggle. No, I was a vegetarian. I'm going to tell you a little bit about my life as we go through this in a sec. Next. Next. Now, part of this lecture is directed towards physicians and for in the healthcare. But I'm going to kind of skip over some of these slides. But there's some slides that I think are really, really important for you to understand, and the reason why our healthcare system fails you. Morbidity and mortality weekly report is a huge. It's a very it's an important document that we utilize in tying together certain literature. Next. In the Morbidity and Mortality Weekly Report, in 1999, this report said one of the 10 greatest public health achievements of the century, 100 years, was safer and healthier foods. That was number 3. On October 2011, the MMWR said in the last 50 years of progress in chronic disease, praised the progress of diet and disease prevention. Next. Yet, over the last 20 or 30 years, over the last decade, over the last 50, 100 years, what's happened? In the 1900s, early 1900s, 1920s, our country ate about 75% of what we ate were whole foods. 25% or less was processed foods. Remember TV dinners when they started coming out in the 50s and 60s? TV dinners, all that started coming out. Processed foods, it became a 50-50, kind of half and half thing. Can anybody guess today, whole foods versus processed foods, in the regular, I know this is kind of a biased group here, but in the regular diet, American diet, what percentage of foods are processed?
90%.
Yeah, yeah. Those of you who are guessing kind of high, you're close. You're closer. 90%, 85 to 90% of the foods we eat are processed. Next. Next. Further emphasis, next. In the 1980s, the Surgeon General said that 70% of all North Americans are dying from diseases directly related to how we ate. Since then, the incidence of diet-related cancer, specifically, like I showed you in that other graph, specifically colorectal, prostate, and breast cancer, have steadily rose. Not just steadily in a constant rate, but exponentially rose. Yet, my colleagues and I are praising ourselves that the biggest achievements that we've made in the last century have been food and safety. Is there anybody confused about this? I am. Oh, we got fat since then. We did. The country just got fat. Next. Please, I'm not being insensitive. I want to make sure we're real clear. I don't mean to be insensitive. I'm being direct. Take this very personally. This is my practice. So what does your doctor tell you? What do we tell you to do? We tell you to. What's your advice, doctor? Next. This is our advice. Next. We tell you to eat more fruits and vegetables. Next. We tell you to exercise more. Next. And we tell you to eat less.
Oh boy.
Those 3 things are the worst advice you can get from your doctor. Good advice from the gym, from your personal trainer. That's good advice from your personal trainer. It's okay. There's nothing bad about that. But from your doctor, you should expect a lot more, because if you do this, everybody's doing this, right? What's going on? Why is this bad advice? Because you should expect more from your physician, from your healthcare provider. You should expect a lot more. Next. A a lot more next. First of all, if you're eating poorly, you cannot out-exercise a bad diet. So if I tell you to eat more fruits and vegetables, and your base diet is junk, and you're eating more fruit and vegetables on top of that, what kind of changes have you made in your base diet? What have you done to make that change? Not a whole lot. Some people can add a little more fruits and vegetables. Can you add 15? Can you add 8? Can you add 9 more fruits and vegetables to that bad diet? When I opened up my clinic's not very far from here. I founded Atlantis Medical Wellness Center about 8 years ago, right after I retired from the military. And it's a couple blocks from here. Across the street was a forest when I opened up my clinic. Today, I walk out the front door, I open the doors, and I see Chick-fil-A, Panera, TGI Fridays, IHOP, Five Guys, Jerry's Pizza, Qdoba, which is a horrible Mexican restaurant. And I'm Mexican. Qdoba, and I'm missing one. Oh, 7-Eleven, and then there's an Asian bistro and a 7-Eleven. That's happened over the last 4 years. Choices, what we are exposed to, is very difficult to fight. When you're running late from work and you've got that 80-hour week, and you have no choice but at 1 in the morning to go to Taco Bell. Not a joke here. What do we tell our patients? Next. So we refer you to a nutritionist. Has anybody seen a nutritionist recently or at all? Ever? Anybody a nutritionist or dietitian here? Even if you were, I'll say the same thing, so don't worry. I'm telling you, when I was in the hospital years and years ago, I was doing inpatient work and